Hi guys, welcome back to my channel 32 Happy Teeth. Today we are going to study barbiturates. I have already posted a video on sedative hypnotic drugs, and barbiturate is a sedative hypnotic drug used for the treatment of insomnia. So I would recommend you to first go and watch sedative hypnotic drug video for a better understanding of this drug. Now without wasting any further time, let's dive into the topic. Barbiturates are derivatives of barbituric acid. And how do they act? They act by increasing the chloride conductance across GABA A BZD chloride channel complex. This channel complex has been told or explained in detail in my previous video of sedative hypnotic drugs, so consider watching that video before watching this video. Okay, now let's get a small review or revise this channel. So as we studied in the previous video, this is an ion channel and it is a GABA A benzodiazepine chloride channel complex. And what does this channel do? So when this channel opens up, it leads to the increased chloride conductance through this channel. So barbiturates, they act or they bind to this channel, and what do? Hence they also increase the chloride conductance because they act as GABA mimetic as well as GABA facilitatory, hence increasing the chloride conductance across this channel complex. So as I said before, GABA mimetic and facilitatory action, these are the two mechanism of action which a barbiturate drug does. And this action, what does it lead to? It leads to the increase the duration of chloride channel opening. So once the duration of the channel opening is increased, it will lead to more increase in the conductance of chloride through this channel. So there is no effect on frequency, but yes, there is an effect on the duration of the opening. Now moving on to the third point, that is, it is mainly indicated for epilepsy and anesthesia. So barbiturates, it is mainly indicated in two cases, epilepsy cases and anesthesia. Which barbiturate drug in epilepsy? Specifically phenobarbital in epilepsy, and for anesthesia, thiopentone is used as an inducing agent. Now let us move on to the next slide. As discussed in the previous slide, barbiturates in clinical practices are used for epilepsy as well as anesthesia, but they are generally not used for other purposes. Why? Because there are mainly broad four reasons for not using it in other cases. The first reason is have therapeutic index due to steep dose response curve. With slight increase in dose, severe CNS depression leading to coma can occur. So they have a therapeutic index, and the dose of the barbiturate drug is like you can say they have a very steep dose response curve. So even if the dose increases by a small amount, the response is a lot more than the dose. The response multiplies as compared to dose. So it has the therapeutic index, but it also has a steep dose response curve. So when you there is a slight increase in dose, it can lead to severe CNS depression. Okay, why CNS depression? As we studied in the previous video of sedative hypnotic drugs, that they are used for the treatment of insomnia. And this channel complex, GABA A BZD chloride channel complex, and this increases the conductance of chloride ions through this channel, which leads to eventually CNS depression. So what will happen ultimately? Barbiturates are also doing the same thing, so they will lead to CNS depression, and if the dose is increased a little bit more, it can also lead to coma. So hence it is not generally used. Second point for not using this drug is powerful enzyme inducing agents and are prone to several drug reactions. Okay, so it is a very powerful enzyme inducing agent. Okay, and hence it can lead to several, or you can say a wide range of drug interactions. That's why it is not used. It is not given for other purposes except epilepsy as well as anesthesia. Now the third point is they have high abuse liability and may precipitate withdrawal syndromes. So there is a very high chance that if a barbiturate drug has been prescribed to a patient, he or she might get might start abusing the drug, and when you when you withdraw the drug or when you stop the drug, suddenly stop the drug, the patient can suffer from withdrawal symptoms. The fourth and the last point why we don't use barbiturates is, suppose if poisoning occurs due to barbiturates because of some overdose, a poisoning occurs in a patient, so we don't have any specific antidote so that we can save the patient. That's why, for the above discussed four major reasons, barbiturates is not advised to give for a large cases. Now let us move on to the adverse effects and contraindications. So what are the adverse effects and contraindications of barbiturates? The first is hangover. So because barbiturates have a long duration of action, there is a very common adverse effect of being a patient of under hangover. A patient can suffer from hangover because of the long duration of action of barbiturate drugs. And also barbiturates can cause distortion of sleep architecture. So barbiturates, it distorts a sleeping pattern. And how does it do the same thing? So that is distorts the sleep architecture by decreasing the duration of rapid eye movement. So it decreases the duration of REM, and it also reduces stage 3 and stage 4 sleep, whereas it increases the duration of stage 2 sleep. So how does barbiturates interfere with the sleep pattern? It increases the stage 2 sleep duration, whereas it decreases or reduces the duration of REM as well as stage 3 and stage 4 sleep, thus disturbing a patient's sleeping pattern. Now the third point is learning and memory impairment can also occur because of barbiturates. Now the fourth is idiosyncratic reaction. So idiosyncratic reaction is possible with barbiturate prescription, which eventually result in excitement that can occur in some patients. A patient might get a lot excited than a normal person, hence it can lead to idiosyncratic reaction. Now the next contraindication is absolute contraindication. Where is it absolutely contraindicated? Yes, it is absolutely contraindicated in acute intermittent porphyria. Now you may ask why? Because porphyrin synthesis is increased due to induction of ALA synthase. So the rate limiting enzyme in porphyrin synthesis process is by barbiturates. So the rate limiting enzyme in porphyrin synthesis, this rate limiting enzyme is disturbed, or you can say barbiturates interfere with this with the rate limiting enzyme in the porphyrin synthesis process, which leads to increased porphyrin synthesis. Why? Because it induces the ALA synthase. Hence barbiturates are absolutely contraindicated in acute intermittent porphyria. Coming to the last adverse effect of barbiturates is, suppose a patient is administered, or by accident a patient takes a high dose of barbiturates. So what will happen? Acute poisoning may occur. So what are all the symptoms which you will see in barbiturates acute poisoning cases? You can see coma, depressed respiration, cardiovascular collapse, hypotension, and barbiturate blisters. So these are all the acute poisoning symptoms which you will see in a barbiturate high dose acute poisoning cases. Now how do you treat such cases? It is treated by gastric lavage, symptomatic treatment. So in the beginning of this video we discussed that barbiturates is a derivative of barbituric acid. So of course it is acidic in nature. So to tackle its poisoning, what can we do? We can do forced alkaline diuresis. So it is treated by gastric lavage, symptomatic treatment, and forced alkaline diuresis. Hemodialysis can also be done along with all of these treatments. With this we end today's topic, that is barbiturates discussion. I hope you like this video, and if you do, so don't forget to like, share, subscribe, and also hit the bell icon. So if you are a NEET MDS aspirant, or if you want to solve MCQs, then don't forget to join my Telegram channel. I'll provide the link in the description box. Till then, take care. Bye bye.